Maggie. I'll be your student nurse today. I just came in to do my head-to-toe assessment. Is there anything you need before we get started?
I don't think so.
No? Okay. So first I'm going to pull the curtain for privacy, make sure the bed's locked and lowered. I'm going to go ahead and do my hand hygiene and put on my gloves. Okay. And am I able to see your wristband? And can you tell me your name and date of birth?
Joseph Williams, 6/2099.
Okay, thank you. And do you know where you're at right now?
At the hospital.
Hospital. And
Yeah.
do you know what day it is?
It's Sunday.
Sunday?
Yeah.
Okay. So you're pretty alert and oriented. Time's 3, the person, place, and time. Are you in any pain right now?
No.
No? Okay. It doesn't look like you're in any discomfort or anything. So we'll go ahead and get started. I'm going to go ahead and check your vital signs to start off with, and then next I'm going to take a look at your head. So if you'll take your hat off for me. And then I'm going to check your scalp for any lesions, bumps, bruises. I'm going to check your hair distribution. Your hair is brown. Put your hat back on. So your hair looks brown, full. I don't see any bald spots or anything.
Yeah.
And next I'm going to go ahead and feel your pulses, okay?
Yep.
So I'll start with the temporal pulses, which is 2+ bilaterally, and the carotid pulses, which is 2+ bilaterally. Okay? And then next I'm going to go ahead and look into your eyes with my light, okay? If I can find my light. I found it. So go ahead and look straight ahead, okay? Good. And one more time. Okay. So pupils are equal, round, and reactive to light. They have direct response. They're consensual. I'm going to have you look at my pen and follow it out. And so Perla is intact and has accommodations. I'm going to take a look in your nose and then in your mouth. So if you open your mouth for me. The mucous membranes look pink and moist. Teeth look intact. Tongue is midline. Everything looks okay in there too. Next, I'm going to go ahead and listen to your lungs, okay? Listen to your chest. So I'm going to go ahead and use the diaphragm of my stethoscope and listen to the trachea. Take a deep breath. And then I'll listen to the apices on each side. You tired?
Yeah.
Yeah. And then I'm going to go down to the second intercostal spaces. And I'm going to lift your shirt up, okay?
Yep.
I'm going to keep my spot, stay up here.
Okay.
So the second intercostal space, and then I'm going to count down to the 4th. Take a deep breath. 4th on this side. Then I'm going to go down to the 6th. And then the 8th. 6th on the other side. And then the 8th. Okay? Okay. So lung sounds are clear to auscultation. Oops. Not yet.
Okay.
Okay. I still have to listen to your back. But before I listen to your back, I'm going to listen to your apical pulse, okay?
Yep.
So I'm going to go ahead and count down to the 5th intercostal space. And I would go ahead and listen there for 1 full minute, okay? I'm going to have you turn around, and I'm going to listen to your lungs on the back side. So I'm going to have you put your head down for me. And I'm going to find the C7 and the soft spots on both sides, the apices. Listen there. Take a deep breath. Okay. And then I'm going to go down, put 3 fingers down. I've got the T3 on each side. Take a deep breath. And then T4. I'm going to go ahead and lift your shirt up, okay?
Yep.
Okay. So we listen to T3, T4, and then we're going to go down to T6. T6 on this side. And then we've got T8. T8 on this side. And then T10. Okay. And I'm also going to look at your back and your spine while we're back here. The skin looks true to ethnicity. The spine looks like a normal curvature. I don't see any bony prominences sticking out. So that's good. Go ahead and turn around. So lung sounds are clear to auscultation in all lung fields. Next, I'm going to go ahead and look at your upper extremities, okay?
Yeah.
So the skin looks true to ethnicity. I don't see any scars or bruises. Are you able to put your arms out like this? I'm going to check your pulses bilaterally. So we'll start with the brachial and then the radial. Both are 2+ bilaterally regular strength. I'm going to go ahead and test for sensation, okay? So I'm going to have you close your eyes, and you're going to tell me where you feel this.
Right there.
Okay, one more time.
Right there.
Okay, sensation's good. And then I'm going to go ahead and check for your movement. So if you'll put your arms up like this for me, I'm going to push towards you, you push back. Good. I'm going to pull, and you pull. Okay. So strength is 5+ in the upper extremities. I'm going to go ahead and look at your hands now. I don't see any clubbing of the nails. The nail beds are a little bit dirty, so that's okay. I'm going to check for capillary refill, which is brisk in less than 3 seconds. Good. I'm going to put those down. And next, I'm going to have you lay down, okay?
Yeah.
I'm going to listen to your belly.
All right.
All right. Sorry, give me a spot here. I'm going to go ahead and lift your shirt. Oh, thank you.
You're welcome.
So first I'm just going to look at it, inspect it. I don't see any, it doesn't look distended. I don't see any pulsations or anything. It looks pretty flat. Your belly button is midline, looks good. So I'm going to go ahead and listen, okay?
Okay.
I'm going to listen to your bowel sounds in all 4 quadrants. And I'm going to go ahead and use the diaphragm of my stethoscope and start in the right upper quadrant. Okay. Bowel sounds are active in all 4 quadrants. I'm going to go ahead and use the bell side of my diaphragm and listen to your arteries, okay? So I'm going to listen for any bruits, which we don't want to hear. So here's the aorta, the renal arteries, the iliac arteries, and then the femoral arteries. Okay.
You hear any?
I don't hear anything.
Whew, thank
So we're
God.
good. I'm going to go ahead and kind of feel your belly now, okay?
Okay.
Going to palpate it. Do you have any tender spots that I should know about?
Just a little ticklish.
A little ticklish?
Yeah.
Okay, I'll be careful.
Okay.
I'm going to just feel 3 times in each quadrant, feeling for anything abnormal. Okay. I don't feel anything abnormal. That's good.
That is
So I'll
good.
put your shirt back down.
Thank
I'm
you.
going to have you sit back up again, okay?
All right.
Okay. So now I'm going to go ahead and look at your lower extremities, just like I did the upper, okay?
Okay.
So the skin looks true to ethnicity. Don't see any scars, bruises, lots of tattoos, so that's okay.
Yeah.
I'm going to go ahead and check your pulses now. So I would check the femoral pulses, and then the popliteal pulses, the posterior tibialis pulses, and the dorsalis pedis pulses. And they're all 2+ bilaterally, regular strength. I would go ahead and test for sensation again. So I'm going to have you close your eyes, and I'm going to ask you where you felt that.
Right there.
Okay, one more time. And where did you feel that?
Right there.
Okay, good. Good sensation. And next I'm going to check movement, okay?
Okay.
So I'm going to place my hands here and push down, and you push up against my hands. Okay. And next I'm going to push against your legs, and you push out against mine. Good. I know it's a little hard. And then I'm going to pull against your legs, and you pull your legs back towards your body. Good. Okay. So strength is 5+ in all extremities, upper and lower. Good. And next is when we're going to have you stand up.
All right.
All right. I'm going to look at your gait and your balance and everything. Okay. I'm going to go ahead and test your gait and balance. So I'm going to have you take a couple steps forward. All right, your posture looks good. You look like you're pretty balanced. Your head's over your shoulders, shoulders over your hips, hips over your knees, knees over your toes. Looks pretty good. Okay? You don't use a walker or anything. Looks like you can walk pretty well. And next we're going to do some range of joint motions, okay? So first we're going to start with your neck. We're going to do flexion. Flexion, you're going to put your chin to your chest. And then extension, you're going to go back up. Good. And hyperextension, we're going to put our head backwards and then back to extension. And then we're going to do lateral flexion, which you're going to put your ear to each shoulder. Good. And next would be circumduction, or I believe it's called rotation. We're going to put our head in a big circle. Good. Next we're going to do our shoulders, okay? So with our shoulders, we're going to do flexion. We're going to put our arms all the way up. Watch the fan. And extension, put them back down at our sides. And hyperextension, we're going to put them behind us, and then back at extension. And for abduction, we're going to put them away from our body, and abduction, we're going to add them back to our body. And we also have, for our shoulders, we have, I believe it is called internal rotation, so we're just going to kind of turn our thumb outwards on each side, and then turn our pinkies up. So it would be radial and ulnar rotation, I believe.
Okay.
Okay, so we did our shoulders, now we're going to do our wrists, okay? So flexion is when we're going to put both of our fingers down. Extension, we're going to put our hands up. And we're going to do internal rotation where our thumbs are out. That's actually radial rotation, and then ulnar rotation is our pinkies are up. Okay?
Okay.
So we've got our wrists. I'm going to do our thumbs next, okay? So for flexion, you're just going to put your thumbs on the palm of your hand. And extension, they're going to go back out. Abduction is when they're away, just like they are, and adduction is when they're back. Okay?
Okay.
And the next is the fingers. Okay? So for fingers, for flexion, you're going to make a fist. Extension, you're going to go back out. And then for abduction, you're going to spread them apart. And adduction, you're going to put them back together. Good. So we did those. Now we're going to do, for your thumbs, we're going to do opposition. So you're going to touch your thumb to each finger. And I'm actually going to go back to the shoulders, because you know what we forgot? Circumduction. So we're going to put our arms in a big circle. Good?
Yep.
All right. Now we're going to work on your hips, okay? So we're going to, what we do to one side, we're going to do to the other, just like our arms, okay? So for flexion for our hips, we're going to put our leg in front of us. Let's try the other one. And for extension, it's going to, extension would just be back at your normal position. Hyperextension is when it goes back. Keep your knees locked. Good. So we're going to do abduction when our legs are away from our body, and adduction is when we're adding it back. Okay, make sure you keep your knees locked when you're doing that. It's hard.
Yeah.
It is hard because of the couch.
Yeah.
So next we're going to go ahead and do our ankles, okay?
Okay.
So for our ankles, we're going to do dorsalis flexion is when we're going to point our toes up in the air. And then plantar, go ahead and do both sides, good. And then plantar flexion is when we're going to point them down at the ground. You do that? Good. And then we have an internal inversion, where you're going to roll your ankle towards the inside of your body, medially. And an eversion, you're going to roll your ankle outwards. Roll your ankle, not your whole, there you go. It's hard for you?
Yep.
That's okay. And then we've got your toes next. So we're going to do abduction, kind of, you spread your toes apart.
Oh.
And then adduction, you're going to add them back.
Okay.
And do both sides and back. Okay? All right, Mr. Williams, I'm going to go ahead and check my paper to see if there's anything I missed, okay?
All right.
I think we got it all. We'll go ahead and look at this range of motion again.
Go bean.
Okay. So for our wrist, it is actually radial deviation when we're bending our wrists inward, and then ulnar deviation when we're bending our wrists outward. Okay?
Okay.
And hyperextension for our fingers is when we bend it back as far as we can.
Okay.
Okay. For our toe flexion, we did forget that. For our toe flexion, go ahead and stand up for me again. We're going to curl our toes downward. Can you do that?
Nope.
And then extension is putting them back. Try to go ahead on the other side. Flexion, curl them downward. Extension, put them back. Okay. Good job, Mr. Williams.
Thank you.
I think that's our whole head-to-toe assessment, okay?
All
Is there
right.
anything you need before I leave?
I think I'm okay.
Okay. Thank you very much.
You're welcome.
All right.